Hey everyone, welcome. Thank you so much for joining us in the second part of PWN's State Legislative Advocacy Training Series. As you might have just heard, this webinar will be recorded today, so you can view it later or share it with friends. But thank you so much for joining us today. So today's webinar is focused on issue-based advocacy, and we will be talking about what issue-based advocacy is, frameworks, and our PWN Colorado team will be talking about their work in relation to the topic of this presentation. Next. Awesome. So we're going to do a little bit of an intro so you all know who we are. We were asking earlier as people rolled in to share their name, pronouns, location, and what they're hoping to get out of this webinar today. So I think we owe you that. So I'll go ahead and get started. My name is Brianna Diaz, and my pronouns are she and her. I'm the policy director for Positive Women's Network USA, and I am based in Richmond, Virginia, but a Texan. So I hold that identity dearly, and I'm just really looking forward to, hearing what Barb and Shannon are going to present today, and really connecting with folks attending this webinar to better our advocacy skills for our communities. So yeah, Barb.
Yeah, hi everybody, Barb Cardell, Boulder, Colorado. I am PWN USA's Training and Technical Assistance Director. I use they, them, their pronouns. And I am also a longstanding community activist in Colorado with PWN USA Colorado. And I will pass to Shannon.
Hi, I'm Shannon, calling in from Grand Junction, Colorado, which is about 4 hours west of where Barb's at. I'm the local field organizer for PWN and founder of Action is Safer Harm Reduction. And I have been Barb's mentee for quite a while and had the pleasure of working with her for a few years and doing really, really amazing things here in Colorado. My pronouns are they, them.
Perfect, thank you. So as I said earlier, you have three amazing presenters that are going to cover a lot of what issue-based advocacy is, key frameworks for doing our advocacy, and some practical examples over the next hour. And we're really hoping, or we want to allow for time, about 10 to 15 minutes at the end of the webinar for questions. Please utilize the chat box or the question and answer feature in Zoom to pose any questions you have throughout any portion of the webinar. We were happy to stop and break things down as they pop up, but yes, there will be time at the end to answer questions about these three objectives that we are hoping to cover today. Next. So real quick, just a little bit about PWN. I'm sure many of you are familiar with us, but for those who aren't, that's totally okay. But PWN is the only national organization in the US led by and for women and people of transgender experience living with HIV. We are a 12-year-old organization, which is awesome to say, and was founded by 20 diverse women living with HIV. Today, we have about 3,000 members nationwide with chapters in Colorado, Texas, South Carolina, Florida, and state leads in many other states, including Virginia and Nevada. And our mission is to prepare and involve women living with HIV in all our diversity, including gender identity and sexual orientation, in all levels of policy and decision making. And that includes state-led advocacy. Next. So, I've talked about this before, and again, you're probably familiar. PWN has a policy agenda that we released several years ago, highlighting 6 key policy issue areas that impact women living with HIV. And those issues are universal health care, economic justice, sexual and reproductive health rights and justice, ending criminalization, trans rights, safety and justice, and ending violence against women living with HIV. PWN recognizes that there are many things that impact women living with HIV to live full, dignified lives. And it is our mission in the policy department to advocate for policies within these 6 identified issue areas that meet the needs and secure the rights of women living with HIV. And this work is done at every level of government, right? It's done at the local level, it's done at the state level and the federal. And that's why we're here today to talk about our state legislative advocacy work, because we know that these 6 issues, which are composed of even more issues like access to abortion, access to affirming healthcare, ending HIV criminalization, these things are happening in our states and in our communities. And it's up to leaders and community leaders like y'all to lead those advocacy efforts. So that's really why we're here today, to connect our agenda to things we're seeing in our states. Next. So just a quick recap, as I said earlier, this is the 2nd webinar in a 4-webinar series, PWN State Legislative Advocacy Training Series. And I see a lot of familiar names of folks who joined us for the first one. And the first webinar was about Legislative Advocacy 101, where we went over, what is legislative advocacy? Like what does that mean? We also went through what is the legislative process, recognizing how intentionally complicated and sometimes inaccessible that process can be. But once we understand and know it, it's a little easier to identify ways to break in and really advocate for issues impacting our folks. And then we also learned why legislative advocacy is important to give our community a voice, right? Like no one's gonna advocate for us, we gotta do it ourselves. And our lived experience enables us to be the experts on these issues. Like y'all are the subject matter experts on issues impacting people living with HIV. So it's important that we show up, or you folks show up to advocate for issues that impact them. And today in part 2 on issue-based advocacy, we'll be building on the first webinar. We learned about the process, and now we're going to talk about how to really do that advocacy in the process we broke down. Next. So, issue-based advocacy, what is that? Next slide, please. So, issue-based advocacy is a little bit self-defining, which is great. I love terms that are self-defining, but it is advocacy focused on issues rather than on candidates. And it's advocacy focused on raising public awareness and action on a political or social issue. So I think this is important to highlight and identify like what is issue-based advocacy, because I know a lot of us work for C3s or engage in C3 work. That's like 501c3. That is a nonprofit status where we are only allowed to do certain types of advocacy, right? Like we're not allowed to endorse candidates running for office or say particular things about political officials like legislators or like the president, right? But issue-based advocacy is focused on an issue, not necessarily a person or candidate. And we can all engage in that work without fear of losing our tax status. So that's important. And also the second point is that when we do issue-based advocacy, we want to raise awareness through education, outreach, and by being state-led advocates of letting folks know of issues that are impacting us and that there needs to be an answer. We need to address and solve this problem. And I wanted to bring up one example in this picture of issue-based advocacy that our PWN folks in Georgia addressed over the past several years. And this was an issue in the city of Atlanta where, unfortunately, funding from HOPWA, which is a federal program providing people living with HIV access to affordable housing, funds issued to the city of Atlanta for HOPWA were not being released to communities. So folks weren't able to pay their rent, or they were having a difficult time being placed in a home. And so our members in Atlanta, in partnership with state organizations like Equality Georgia and Thrive SS and Sister Love, we all got together and did a little bit of media outreach. We reached out to the Atlanta City Mayor, Mayor Bottoms. We reached out to the Atlanta City Council, and we reached out to HUD, the federal agency in charge of HOPWA, and made them aware of what was going on, how this was unacceptable, and that they needed to quickly remedy this issue because people need their housing. People have a right to safe housing. And so I just wanted to highlight this one example of like where our PWN folks identified a problem and created an advocacy campaign around it. The issue, housing. Next slide. So other issues can include reproductive rights. I know a lot of folks in a lot of southern states constantly deal with reproductive rights. We know abortion is constantly on the table in state legislative sessions. Voting rights is always on the table. LGBTQ rights, that can include non-discrimination, that can include a whole lot of things. Healthcare, expanding Medicaid, that is also an issue typically left up to states. And then we're very familiar with sex work, HIV, and drug use decriminalization. I know folks in the chat were talking about harm reduction for advocacy campaigns that they're leading. I know Shannon and Morgan highlighted the work they're doing in their respective states. That is issue-based advocacy. Next slide. So now that we know what issue-based advocacy is, I kind of wanted to go into advocacy frameworks, right? It's one thing to identify an issue that you would like to advocate on, but it's really important that we're able to do that advocacy in a framework that addresses people, like a particular groups of people and communities that are disproportionately impacted by that issue, and ensuring that when we talk about and advocate for an issue, that we are including everyone and not being exclusionary in how we advocate for and talk about issues. So today I'm going to cover racial justice and gender justice frameworks, but I want to make clear that those are not the only two frameworks under which we at PWN, and I know many of our folks, do their advocacy around. Like I highlighted, we have economic justice is a similar framework, reproductive justice, trans justice, which we include in gender justice, but I want to highlight that one. Climate justice, there's so many different things, frameworks that we can utilize and apply in our advocacy. But just for today, I'll be covering racial and gender justice. But we do discuss the other ones in other webinar series and in our policy fellowship. So learn more and join us. Next slide. So I want to start with racial justice, the racial justice framework, and start it off with a little bit of background about a Declaration of Liberation that was drafted by the HIV Racial Justice Now group, coalition. I'm sure many folks are familiar with HIV Racial Justice Now. But in 2017, they published the Declaration of Liberation, Building a Racially Just and Strategic Domestic HIV Movement. And the framework was drafted and edited by over 20 HIV movement leaders of color from across the nation in a collaborative process that spanned several months following an initial convening in July of 2017. The framework was drafted with the hope that it would be adopted and used by organizations involved in HIV care, prevention, research, and advocacy to analyze and adjust their practices, and so that it can also inspire leaders of color working in the HIV movement to join forces and demand a racial justice audit of their organizations. And so, this amazing letter, our declaration that we will share in the chat and is also going to be a resource we send out, I think provides a great outline and framework of how we can apply racial justice to every part of our advocacy, right? Like it touches on stakeholders. That's a term that we talked about in the last webinar. People who are involved and have a claim or some sort of like stake in an issue, right? So like when we talk about HIV advocacy, we're talking about ASOs and CBOs. We're talking about HIV organizations like PWN and many others that y'all are familiar with. And we're talking about our communities, ourselves, and the work that we do in our advocacy. And so, the Declaration of Liberation says that a racial justice lens for the HIV movement demands that we integrate racial justice into our organization and political strategies. It means that we must center those communities most impacted by the epidemic in leadership and decision-making, right? Nothing about us without us, like right there. We must root our efforts to advance a racial justice lens in the HIV movement and accountability to the communities that we lead. And it ensures equity around allocation of resources, human, material, and financial. That is a big one to carry into coalition work that we do at the state level with our advocacy work. And finally, it's work to transform and, where necessary, dismantle the institutions that uphold white supremacy and compromise the well-being of communities of color. I know that's a lot said at once, and that's okay. We will provide the declaration in the chat. Awesome. Okay, now, but I wanted to root the definition of racial justice I'm about to share in the next slide with you all, root it in where it comes from and what it is intended to do. So, racial justice. The Declaration of Liberation defines racial justice as the collective practice of people of color and allies to identify, dismantle, and heal from the many external and internal harms of structural institutional racism. Right? This practice invites us to collaborate across communities of color in service of dismantling white supremacy and building power. And then I'll just skip to the last point, is we envision a movement premised in solidarity, collaboration, and in coalition. I'm sure folks that have done state legislative advocacy or really any advocacy in their life are familiar with this vision and this call. Again, this racial justice is a framework upon which we must do all of our work to ensure that, the needs of the most marginalized are recognized and prioritized as we advocate around issues. So next slide, I'll break that down a bit and apply this framework to some examples. So racial justice and advocacy, I know I threw a definition and it's sometimes hard to understand, like, how do I do this? Like, I understand what you just said. It's an important framework. I agree, but like, how do I apply it? Well, like, we're going to be advocating on a lot of issues at the state level in 2021 that impact us, right? And so I provided a couple of like recent headlines that I think will like really resonate and maybe paint a clearer picture of how to apply this framework. So we know that COVID-19, it's been almost a year of us being in COVID-19 pandemic world, and it has disproportionately impacted communities of color, whether that be the actual virus impacting Black, Indigenous, Latinx, and other people of color, or even how it has shown up in jarring our day-to-day lives, right? Like COVID-19 has disproportionately impacted BIPOC communities when it comes to employment, when it comes to housing, when it comes to childcare, when it comes to education. And so, when we talk about COVID-19, relief packages, whether that's like, a survival check or it's funding, like increasing funding to certain programs for people, we need to ensure that we are talking about the things that are needed for the most impacted folks. That's an example. We know that studies show in every state that there's been a study, and we just know from our lived experience that HIV criminalization laws disproportionately punish people of color. That is just a known. And so when we talk about HIV criminalization in our advocacy work, we must always talk about it through a racial justice lens. We must always talk about it as who it impacts the most and why. And another one real quick is just Georgia ranks 50 out of 50 in maternal mortality rates in the US, with the worst outcomes for Black mothers. So when we're advocating for racial reproductive rights, safety, and justice at the state level, we need to ensure that the bills that we're advocating for include language or include a scope around addressing the issues that lead to this reality. That like there is a significantly worse outcome for Black mothers when it comes to the mortality rate. Like that stems from very real, tangible things that we can address in legislation. And I know there's other examples, but I got to rush for time. but please, if you have anything to say on this issue or want to talk about your work, put it in the chat, pose a question, and we will totally unpack this framework more. Next slide. So gender justice is our second framework. And gender justice, we say it is a human right that every woman and girl is entitled to live in dignity and in freedom without any fear. And it refers to a world where everybody, women and men, boys and girls, are valued equally and are able to share equitably in the distribution of power, knowledge, and resources. And so I know that can be like pretty binary language. And so I want to affirm that when we talk about gender justice, we're not narrowing this into a binary understanding of gender. We recognize that every person is composed of intersecting identities and experience the world in very different ways based on their identity. And so I think it's really important, and PWN does this, where our understanding of gender justice and how we apply that is that we apply it to all people, recognizing that like there are a lot of disproportionate issues for women, but when we talk about women, we talk about like the full spectrum of women. So next slide, I'll break that down a little bit more next. So our gender justice includes trans justice, right? So our gender justice is rooted in autonomy, that people have the right to decide what they do with and to their own bodies. We recognize that all women means all women, that trans women and cis women, they share many experiences, but also have unique experiences. And there's beauty and power and strength in that diversity. And it is through that diversity that we're able to apply a gender justice lens to our work, right? And then, we have unity around issues like state violence, access to healthcare, and family formation. We have to make sure that when we talk about these three issues and many more that impact women, transgender, non-conforming, and non-binary people, that when we're addressing legislation on those things, that they're reflective and inclusive of all those lived experiences. Next slide. So just a couple of examples of gender justice and advocacy. We talked about COVID-19 earlier and how it has impacted, communities of color. We can apply a gender justice lens to COVID-19 as well, right? So PWN recently published a piece entitled Addressing a Crisis Within a Crisis, Intimate Partner Violence, HIV, and COVID-19. And what this was, in part breaks down is that, during COVID-19, when folks are forced to stay home, if they even have a home, that sometimes left folks at home with their abuser with absolutely no way out. And, this is a situation, a real lived experience, particularly for women living with HIV, particularly Black and Brown women living with HIV. And I think it's, when we advocate for policies around intimate partner violence, coupled with a COVID-19 response, we have to uplift this lived experience for so many in that discussion and ensure that any sort of solution or response to the issue that is made in the form of legislation, whether that's funding for a program, expanding who has access to a program, this must be central in that analysis, right? If this is a good bill or bad bill. And then I also wanted to include a statistic back when the Affordable Care Act, when the Trump administration redefined Section 1557 of the ACA's non-discrimination clause to exclude, to remove discrimination protection, non-discrimination protections for trans folks. And so, when we talk about access to healthcare, we have to make sure that we are including in that issue-based advocacy, the right to inclusive and affirming and accessible healthcare for all, right? And that includes our trans siblings. And then again, like COVID-19, especially harmful for working women, yeah, like that's a real reality. And I'm sure a lot of us are intimately familiar of now having to work from home while also being childcare providers as well as being educators for our children. And that has disproportionately impacted actually Black, Indigenous, Latinx women. So there's a gender and racial justice framework right there. Next. And so I am done, and I'm turning it over to Barb and Shannon to apply everything we just went over into practice. Would you like me to share my screen, Barb?
I think I can actually handle it here if you want to do the chat box. I can go ahead and share slides here. So thank you, Brianna, for that really great overview about issue-based advocacy and how we can start to identify the issues that impact the lives of women living with HIV and really both partner and put pressure on our state legislators as we are holding them accountable to the things that we know that impact our lives and our lived experience. So today we're going to talk about an example of a bill in Colorado. And first I wanted to introduce the players. In Colorado, we actually have a PWN chapter, and we also have a partner organization. We actually have a number of allied organizations. Sort of our major partner, especially when it comes to legislative things, is CORA, which is the Colorado Organizations Responding to HIV and AIDS, and it includes individual membership as well. And so these are some photos of outreach and advocacy that we have done over the years. Our PWN chapter has been around since 2012, and CORA actually has been advocating since 1987 at our state legislature around a number of issues that have been impacting people living in Colorado with HIV. So here we have, starting over on the left, we've got our advocate, Shannon, our advocates actually on the Western Slope. We are a statewide organization, and so we do a lot of advocating for folks in rural areas as well, bringing in our partners from the Western Slope. We've got Rika in the middle, Rika Rodriguez, who's a PWN board member and Colorado member. She actually is showing how you bring letters to legislators back in the day when we could actually go to the state capitol. We have got our HIV Advocacy Day up at the top, when we went and we had 40 advocates from across the state who went and really talked to legislators, not so much about specific bills, but about HIV issues, as well as all of the policy points that Brianna shared earlier. And then finally, in the lower corner, we've got One Colorado, which is our LGBTQ advocacy group in the state, which is one of our allies. And we also have our LGBTQ legislators who are our legislative champions. And we love to talk about them and how powerful they are in making sure that both HIV, as well as a number of other LGBTQ and harm reduction bills are passed. And they are always so interested in listening to what we think is important and also really partnering with us around language, especially around stigma when it comes to any issues that are impacting people in Colorado. So that is CORA, and I will turn it over to Shannon so they can go ahead and talk a little bit about one of the bills that we worked specifically on this year in 2020, and we will actually break down the entire process once we do a little bit of an introduction.
Thank you, Barb. So we have our HIV prevention toolkit, which does include care and treatment, testing, as well as PEP and PrEP. PrEP is highly effective in preventing HIV. And one of the things that we worked on was accessibility across the state. It reduces sexual transmission by 99%, reduces the risk for people who are injecting, whether that's steroids, hormones, street illicit drugs, by at least 74%. And then we have PEP, which has to be started within 72 hours, taken for 28 days, and reduces the risk of acquiring HIV by 89% or better. The biggest challenge, I think, in the state of Colorado is actually affordability and access to pre and post-exposure medications to prevent acquiring HIV. And rural areas are greatly affected. Where in the metro area, we have doctors who prescribe those medications to people. Here on the Western Slope and in rural areas across the state, we see a lot of stigma around that. And we especially see that as it pertains to women, thinking that folks don't need that, that women may not have partners, that they're not at risk for HIV, they're not sex workers, they're not injecting. And so we see huge barriers to that. And we were able to work with, to advocate for access to these medications specifically for women. Next slide. So Colorado House Bill 2010-61 was introduced by Leslie Herod, and we have been seeing a rise in HIV diagnosis every year for the past 5 years, and we've seen a huge rise in the Western Slope area. For instance, Mesa County, Delta County, and Montrose County saw a huge increase, not only among men having sex with other men, but women testing HIV positive. And we have very few resources. We only have one AIDS service organization for 40,000 square miles. And generally, that's the only testing program for people to get access to free testing, access to free navigation for PrEP, and so on and so forth. So through a One Colorado survey, we found that 42% of LGBTQ plus folks were worried about their healthcare was not, their providers weren't supportive. Their providers discriminated against them or stigmatized them. We saw that here on the Western Slope when we were referring people to PrEP, that providers, trying to get providers to sign on as a prescriber here on the Western Slope was really, really difficult. And there are existing laws that allow for contraceptive and smoking cessation, but not prevention and postvention practices. In fact, one of the things that our champions, I think, missed the mark on was talking about women and HIV, women and living with HIV, and women needing pre and post exposure medications. Next slide.
Great. So thank you, Shannon. So it comes back to what we were trying to address, which were we really identified certainly these issues that needed to be advocated around. We were talking about gender justice, we were talking about racial justice, and we were talking about economic justice. And so we knew that we wanted to be a partner in this bill and how it was being introduced so that the prescription access for the pre and post-exposure prophylaxis could be used in these areas that often were underrepresented and underutilizing. And we knew that there was definitely a need because we could see that new diagnosis rate increasing every single year. And so the tools were not getting to the communities that were most impacted. And within those new diagnoses, they were in the communities that we saw. was a rural community. Women and communities of color were making up a large part of those new diagnoses. And so that was why I think that we were so able to partner and be so effective in getting this bill introduced. And so just to be clear, what the bill was hoping to do was to allow pharmacists to be able to prescribe both PrEP and PEP access for anyone who wanted it, so that people did not need to go to a doctor to get a prescription. They did not need to go to an emergency department if they had been exposed, that they could go to a local pharmacist, that they didn't need to worry about convincing their doctor or having difficult conversations with their doctor that we now know are stigmatizing for so many folks. So it was going to be able to increase that access, as well as to give people access round the clock, because while there might not be doctors that are available 24 hours a day, most communities have a pharmacy that is open 24 hours a day. And so being able to access the PEP, the post-exposure prophylaxis, would be very valuable, because there is a time limitation on getting it prescribed and its effectiveness. And then also around PrEP, that most of the time, pharmacists are from our community. And so they are people we feel comfortable having difficult conversations with. And so we wanted to make sure that we were utilizing these existing laws that allowed for pharmacists to prescribe already contraception as well as smoking cessation. We wanted to be able to make sure that people had access to that. So back to the slides. This graphic is a neat and tidy way of how the process is supposed to work. You start off with community legislators, come up with an idea, a concept, a bill is drafted. It goes to the House, goes to committees to provide some input. Then it comes back to the House, passes on to the Senate, goes to a Senate committee. It comes back to the Senate and is voted on and passes all of that, and then goes to the governor, is signed. It looks very neat and tidy. Sometimes it even works that way, but not often. So this is a review of the legislative process in Colorado, and it very, very rarely looks quite so tidy. And there's lots of bouncing back and forth and stalling out and concerns. And so here's actually what the process for this bill looked like in Colorado. And in the middle of it all, we had over a 2-month adjournment, so that the legislature would close down so that people could go back home and be safe during the COVID pandemic. And so we, got it introduced in the House. It was going great. It went to the Public Care and Health Services Committee. They voted it out nearly unanimously, and it was bipartisan, but then it needed to go to appropriations because they felt it would have a fiscal impact, so that slowed it down and actually potentially stalled it out. But it passed, woohoo, and then was sent to the full House. And in Colorado, it gets 2 votes in the House and passed through fairly quickly there, and then went over to the Senate, and they closed it down. They basically shut everything down, which was good in a way, because we knew that when they came back, that it was going to be one of the first things that they took up. So it gave us time to organize in that time that they were closed down, to start talking to community members about both advocacy, but also about the impact that this would have. And so we used that time to organize. So the Senate came back, and we actually heard that they were going to kill the bill without even hearing it on the Senate side. And for COVID and for Colorado's economy, we had a pretty drastic shortfall. And so they were going to only vote on bills that were going to impact the economy or access to healthcare for people, especially around coronavirus. So we were, as you can see in bold here, those are opportunities for us to advocate. So we started advocating on May 27th when they came back that they should not kill this bill, that they should consider it an important part of the coronavirus package. Pivot. You got to pivot and pay attention and think about how you can go ahead and talk about what's important to you in ways that are shifting. And so for us, we were able to make an argument that this bill was more important than ever, because with people sheltering at home, people using telehealth, people having to talk about why they might need PrEP or PEP, at home on Zoom where their whole family could hear was not safe. And so we made an argument that people needed to be able to go to a pharmacist more than ever when we have things that were going along in the coronavirus pandemic, and people's lives were changing and people's access to medical care was changing. And so we made that pivot, and that kept the bill alive. And so it got heard in the committee and passed out very quickly, went to appropriations because they needed to consider the funding again. Then all of a sudden it looked like the governor was not going to support it because of the shortfall in revenues in the state of Colorado. He wasn't going to pass anything that had a mandate. So we followed the bill all along, made changes all along, and made compromises all along. The mandate was about health insurance companies being forced to pay for it, whether it was prescribed from a doctor or a pharmacist. We had to let that go in the interest of keeping this bill alive. But as you can see, we had an opportunity to both provide impact statements, to testify, and also to follow and shift the conversation throughout the entire process. And that is why it's so important for us as people who are impacted by these bills that go through to be able to follow along, to read the 13 amendments that were attached to this bill, and to make sure that we weren't losing anything that was critical, but that we also were willing to draft compromises that were at least something that kept in mind a lot of the needs that we had. So now we're going to go ahead and talk about the actual opportunities for advocacy. So that's the big picture. And it is easy for us to think that as advocates and as people living with HIV and our allies, that we are not lobbyists, that we are not savvy around politics. We actually are the most important part of this process. And so want to talk about all of the opportunities that we had to really provide impact, and to talk about how important it was through the process, because it turns out, according to our legislative champions, our involvement is what kept this bill alive and actually had it enacted just a few weeks ago, which is really exciting. So Shannon, you want to talk about opportunities for advocacy before it even started, before the bill was drafted or before session started?
Sure, thank you. So I like to call it a call to action. So we were able to talk about the impact and determine the community's needs by talking to community members and building coalitions. So talking to other, what I call network partner organizations, other folks, Planned Parenthood of the Rocky Mountains, Harm Reduction Action Center, some other, One Colorado, some other partner members to build coalitions and include community members who were directly impacted in those coalitions. You know, they say the disability advocacy and movement has always talked about nothing about us without us. And so we can talk about nothing about us without us is ever for us. And we need to include those, the people directly impacted in those coalition builders. And then we looked for potential sponsors, our legislative champions, talking to those coalitions to see if they would sign on to letters, send emails, call their representatives, and then educate those sponsors and representatives. So, you know, we couldn't do that in person this year. So often most of that had to be done virtually. And what I talk about is showing up, attend virtual discussions, attend roundtables that those elected officials are having, and educate them on what our communities need. And then we so sign on, email, call, show up, attend virtually, have virtual town halls with folks, invite those folks, invite the legislators to those virtual town halls, share widely on social media. And I'll tell you what really, really makes an impact is tweeting about this stuff. And so we were able to educate our sponsors and review the drafts of the bill and get back to them about, well, I don't know about this language, or, you're missing women in the language of the bill. You're missing women when you're talking about this with other folks. And so the more folks that we got to sign on to this, and the more women we got to testify virtually, to write letters, to call, so on and so forth, we saw that folks realized that PrEP is not just for men. PrEP is for women, for non-conforming folks, and women of trans experience. And that is really, really, really important. Women, talking to Indigenous communities and getting our folks on board with that. So, not just our not so sun-kissed folks, but talking to our Black, Brown, and Indigenous women about supporting this pre-legislative session. Thank you.
Great. So that's the work that goes on year round, that you can start building relationships with your legislators before there's a bill, before there's a concept. That is background, and that is so important because once the bill starts to move, once it's drafted, it can move pretty fast. And so you want to make sure that you know who to talk to and what points you want to bring up. So once the bill was drafted and it moved to the House committee, we were able to make sure that we had people there who were able to testify around these specific points that weren't really in the bill, but we thought it was so important that became part of the official record that was attached to this bill. So we talked about HIV stigma and discrimination. We talked about barriers to care, including low income folks. We talked about the importance for women and rural communities for PrEP. We talked about, as well as transgender folks, we talked about the importance of increasing PEP access to 24-hour pharmacies. None of the legislators had actually thought about what that would be like if they had needed a prescription or needed to be able to access that in a rural area. So we were able to have rural folks who told them what that was like, who shared the stories. And then we also talked about just location, location, location. And again, it goes back to access on that. So that was our opportunity to advocate at the House committee. And it was powerful. It was powerful. Then we went to the Senate after we came back from the COVID, and another opportunity to advocate. We had nearly 3 months from the first testimony in the House to the last testimony in the Senate. And so we were able to shift our message and see what were they not talking about, what were they not asking questions about. And so we went ahead and we pivoted for the COVID legislation like I talked about. We talked about the removal of the mandate so that to ensure it would be signed by the governor. We talked about deep community support, importance for easier access, and then we also talked about compromises with physicians and the Board of Nurses and their concerns. So we talked about work that we had been able to do, and we had to do this all written because, of course, we weren't allowed in the State House because there was still shut down because of the pandemic. And so we did this via email, and we sent it to every person on the committee, and we sent it to every senator. And so we were able to share both information and knowledge with everyone. And we also gave them folks that they could ask questions to if they had any questions. And so that was how we managed to advocate in the Senate, pivoting, changing because we needed to. So that passed. And then we had a chance to go ahead and actually put pressure on the governor because after it had been voted out of the Senate, he had a whole boatload of bills that were on his desk. And so we were able to talk to him about something like, for example, having a bill signing that had a whole bunch of human rights around HIV, around transgender folks, around LGBTQ folks that he could sign all together so that we could make sure that he would have a whole bunch of both press as well as celebration to know that we were appreciative and that we really were going to remember that this was something that he had prioritized and had signed in a session where they said that they weren't going to work on any of these things. And so we were able to get the governor to sign a bill both on the PrEP and PEP access. He also at the same time signed in a ban on trans and gay panic defense, as well as being able to get new birth certificates for transgender folks without having surgery or without having to go through a lot of hoops. And we also were able to pass our sexy ADAP rebate funding bill, which when you talk about funding and you talk about rebates, people usually fall asleep. But we basically packaged it all together and talked about it as a victory for human rights and for people who are living with HIV, our transgender folks, as well as our LGBTQ folks. And so that really made it powerful in a way that gave us a lot of lift in a time that was hard to accomplish a whole bunch of things. And so that is how we managed to actually, from soup to nuts, go through and advocate on a bill, or actually a number of bills in Colorado. And we look forward to, if anyone has any questions, being able to answer the specifics. But I'm going to pass it back over to Bree.
Awesome. Yeah, thank you so much, Barb and Shannon, for sharing like the last PowerPoint webinar and this one, like identifying an issue that required folks to advocate on, and then like navigating the complicated COVID-19 version of the Colorado legislature. I'm not envious of the 13 amendments. That must have been a headache. So nothing but respect. But yeah, I know we just went through a lot, and that's totally okay. I wanted to share, again, this awesome advocacy guide that PWN put together. It's the How to Do Advocacy Guide for people living with HIV. And it very much informs this webinar series. So at any point in time, you want a refresher on how to do all the things we're talking about in this webinar and the future ones, I recommend, using this awesome guide that I just shared in the chat. Wanted to plug it next. Thank you. Just a couple of resources. We've shared these in the chat, and we'll make sure to share them in the next. So we are now at questions. So yeah, if you'll have any questions about this webinar's content or the last one, or just generally want to talk about state ledge stuff that you're doing, if you want to share your work, please put questions, comments in the chat, or use the question and answer features. We've got like almost like 10 minutes to hang out.
Brianna, I'd like to add something that we've done for HIV Advocacy Day in the past, is talking to people about what to expect. And when we were doing in-person work, Barb had a great map of the Capitol so that we knew where folks were. And that map included bathrooms and rest areas. Super, super helpful. I hope that there is a time that we can do more in-person work. But definitely knowing what to expect helps.
Thank you for sharing that, Shannon. Oh, thank you, Cruz. So is this possible, this presentation on Spanish? I can provide the slides in Spanish, yes. And then going forward, we will have to be more mindful of language access and providing an alternative. So thank you for that call-in.
And then Brianna, it looks like Morgan had a question about, and it's actually a great question for all of us. So how do I know what's going on in my legislature? I'm not sure if it's going to be shut down or open, and how can I kind of hear what's going on?
Morgan, that is the question, I feel like, of 2021. I think that's really dependent on your state. Every single state has different rules, whether they be constitutional or set by your legislature. We kind of sort of went over this in a Texas presentation we recently did. How sessions meet, whether in virtual, in person, or a combination of both, truly is left up to that state. So you are, I forgot exactly where you are, but if you would like to shoot us an email, we're happy to like research that with you. but I have seen in like the 3 to 4 states that we know have like their sessions planned out, they are a combination of both virtual and in person for 2021. Alabama. Okay, yeah. I do not know Alabama, but we can definitely look into that.
One of the things that I do here is I look at local, state, and federal bills. And so I follow Ballotpedia and bill trackers. And we can get some bill tracker links to you. And then I go on the local and state meeting. They have most states have sunshine laws where those meetings have to be announced and they have to have an agenda. And so that's one of the things that I do is I save the links so that I can look and see when those meetings are or special sessions are occurring, and at least follow, maybe I can't do anything before the meeting, but I can follow something that happened in the meeting and look at upcoming meetings and discussion around whatever bills or issues.
Yeah, thank you, Shannon. That is truly is the key to like any state legislative process is like the agenda. Like that tells you so much you need to know. Crystal said, I've looked for this info in Texas and it was not easy to find this info online, or maybe I'm not looking at the right place. Do you know a site to find this info in Texas? Yeah, so for finding out if your session is going to be meeting in person, that should in Texas, that's not going to be announced until probably like day 1 of session, just based on their rules. The House Speaker actually sets a lot of the rules in how legislative, like how the legislature works in Texas. So I would anticipate not knowing the specifics of COVID-19 till later. And then as Tana said, you can set up bill alerts on legislative issues on various trackers. Or even just like in your Google alerts. That's pretty helpful. And Shannon, I don't know if you are able to plop in the chat like like what you use in Colorado. So maybe that can help people in other states. So yeah, sorry, we don't have a solid answer still, Crystal. It's just it's a mess. And then Morgan is asking, I also wonder if anyone has experience with SSPs being asked to use uniquely identifiable syringes. We don't love that language and it seems prohibitively expensive. This is a question for harm reduction folks.
So we have seen that here in Colorado, and I really caution against it because that really outs people. That would be like an ASO doing some sort of identifiable stuff that people are maybe leaving the office with that may, violate HIPAA. So I would talk about that, and I can connect you to Louise Vincent, who is on the board of the National Urban Survivors Union. And Morgan, we can talk offline about that. And I will drop the Ballotpedia link in the chat.
Thanks. I want to be mindful of folks' times. I know we're 2 minutes after the hour. If you have questions, okay. Yeah, I'll let Morgan and Shannon connect. But yeah, please, thank you so much for making this webinar and the last one too. We have 2 more in the series in the new year, which I'm hoping is better than this one. Our 3rd webinar is building support for your issue through effective messaging. We'll be joined by PWN's comms director, Jenny Smith-Camejo, for that one. And then our final webinar of the series is community mobilization in February. And we will be joined by the ever amazing and great Ebony Turk, another PWN staffer, in the organizing department. Yay! So please join us for those too. And then finally, I know Barb shared it earlier. Please take a few minutes if you can to fill out our survey, our evaluation survey. It's really important for us. We review it and base our presentations off of the survey results. So please take it and be brutally honest. We love it. But other than that, I really want to thank Shannon and Barb for offering all their expertise on the ledge and issue-based advocacy. And thank you so much for joining us today, y'all. I really look forward to seeing all the work that you do in your state legislatures this next session.
Thank you. Have a wonderful day.
And thanks everyone for joining us.